should be coming up soon. Okay, we're good on Facebook, we're good on LinkedIn, we're good on YouTube, Twitch, and Daily, and now we should be good on Instagram. Okay. So, hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Laurence Doan, and today we are joined by Dr. Sahil Soni. Dr. Sahil graduated from the University of Otago, New Zealand in 2009 and has been working in private dental practice since then. He enjoys all aspects of dentistry with a special interest in cosmetic dentistry and root canal treatment. Sahil is very passionate about his work and is up to date with new techniques and technology to keep up with the improvements in dentistry. Sahil is extremely passionate about mentoring and teaching the new generation. Dr. Sahil Soni, welcome to the show.
Thank you. Thanks for having me.
Thanks to everyone for tuning in. We had a few technical problems, but here we are. So, you have a special interest in cosmetic dentistry and endodontics, but that wasn't always the case. Tell us about your CPD or dental journey so far.
Well, I think my CPD journey, my dental journey is similar to what a lot of people experience. When I first graduated, all I really wanted to do was make some money, pay my student loan off. I felt like I had graduated with a lot of gaps in my knowledge, a lot of, stuff that I wasn't sure about. So anyway, I started working at this practice in New Zealand where I was pretty much just taking teeth out mostly. And before I had graduated, funnily enough, I had never done a surgical extraction where I had to section a tooth, for example. And in my first day on the job, I had to section a tooth and, I got stuck. And anyway, so it was a lot of learning on the job as I went along. And, I kind of did not enjoy dentistry for the first 2 years, I would say, because largely because I didn't know what I was doing really, and I wasn't really good at what I was doing either. So it was just a means to an end, really. I'd spent 5 years studying it, so it wasn't fulfilling.
Yeah. So you mentioned extractions wasn't you're the best. You weren't best at it at the time. You had a few struggles as well. So how did you kind of tailor your CPD in that sense?
Well, at the time, my first 2 years, I did not do very many CPD courses. My plan was to save money, and I pretty much only went to the free CPD courses that the specialists would organize, like an hour after work or something like that. So, but what I did learn was from my first employer, my boss, in Auckland, Jackie Lamb. He owns quite a few dental practices. And I sincerely, from the bottom of my heart, thank Jackie for teaching me how to take out teeth. He taught me how to use a luxator, which is a very crucial thing to know how to use if you want to be proficient at taking teeth out. So once I learned that, it was just a matter of practice. And I think after 3 months of taking out teeth on a daily basis, I felt pretty confident, like I could take out most teeth. And after about 9 months of mostly doing extractions, I was sick of doing extractions. I felt confident I could take, any tooth out. And I was kind of bored of doing extractions. And it was at that time I moved to Australia.
Yeah, so that's right. You moved to Australia and then you moved out to Kempsey, wasn't it? And you were working out in a rural practice for a good solid year or two. So, I mean, how was it then? Were you taking, because you were taking a few more extraction cases on during that time?
Yeah, well, at that point, it was me and two other dentists working together in the same practice, and there was a chronic um, disease dental scheme on at that time, like the EPC scheme it was called, where patients would come in with a voucher for dental treatment, and we were allowed to do up until like $4,000 worth of dental treatment, including crowns, whatever they needed, up to the value of $4,200. So I found that practice was predominantly seeing these patients. So we ended up doing a lot of dental treatment. A lot of it was needed, but I found the mentality, at that practice was just try and make full use of that voucher. So we made a lot of like, partial dentures and stuff like that, which I think weren't maybe needed. If they have a missing seven or something like that, I don't think, every missing seven needs to be replaced, but at the time we would just make a partial denture.
Sure, yeah. So, I mean, so during this period, were you taking any CPD?
No, I was not taking any CPD. I think after 2 years, the first major CPD I took was a 3-day composite course with Jason Smithson.
Yeah.
And it was the first kind of, big sum of money that I was spending. It was $5,000 for these 3 days. And it was simply because I was kind of getting pretty sick of, dentistry. I was like not happy with the work I was producing. And, it was kind of upsetting me. So,
This is the restorative side, you're saying. Like the restorative
yeah,
side of you're doing fillings, all of that, anterior, posterior, but you weren't quite happy with what you were doing.
exactly.
Yeah. And
So,
yeah.
so that's when I did this course, and I spent a bit of time talking to Jason, um, in the breaks and stuff, and just how like I saw his work, and it inspired me. I was like, what do I need to do to produce work like this? That's basically what I wanted to know, and I realized this guy, everything is done under rubber dam, and that was one thing I was not using routinely. I would say only for root canals, that sort of thing. So it kind of started my journey of self improvement. I would say it was after that course, after seeing his work, and after talking to him, I was motivated to improve myself.
Right. Yeah. So you felt more inspired at the time. And then that's what really compelled you to start your journey into learning more about aesthetic dentistry.
Yeah.
Yeah. So where to from there? After you started doing this, the Smithson, where'd you go to next?
I did a lot of courses after that. I did pretty much every course that I could do, I would do, because I was learning so much every time. So I've done pretty much all composite courses that are available. I've done them. Didier Dici, Angelo Putignano, Tony Rotondo, everyone. You
Yeah.
can, you know.
And where were you finding these courses? I mean, because I've talked to a fair few senior dentists, and they talk about how, at the time it wasn't as easy as it is today now. People could go online, they could find it very easily, but back in the day, it would be just maybe through the ADA booklet or something like that. I mean, where
Yeah,
did
pretty
you
much.
find your information? Was it from someone recommending it to you?
No, it was mostly like, the ADA magazines would send, pamphlets and course information, or a friend who's going to a course, so they might say, "Hey, Sahil, do you want to come along?" And so it was that kind of thing. DPR was around, so like it had just kind of started at the time. So occasionally you might see a course on there. Then I might attend that. Yeah.
Right. So that's your aesthetic side of dentistry. You're doing a lot of these composite courses, and you're building up it along the way. So along the way, when did the wax up start to become incorporated?
I think just as part of understanding aesthetics, like initially I saw Tony Rotunda. He did a wax up that I saw online, and I was like, he had put anatomy on the palatal side of this lateral incisor, and I was just thinking to myself, like, this level of detail, who is going to notice this? Like, no one.
Yeah.
But at the same time, like, Tony's a guy I really look up to. So I thought to myself, if Tony's done it, um, I need to kind of not question why he's done it. I need to think, why am I not doing it?
Right.
So, that kind of made me want to get better at it. So I've done a couple of wax up courses overseas in Taiwan. And yeah, it's just a great learning exercise. I think, once you routinely do it, it really helps you see the shapes of teeth better. Yeah.
Or even like you've said before, starting with the end in mind.
Yeah, yeah. I mean, that's why you do a wax up, really, is to have a plan where you're going. Otherwise, without a plan, without a blueprint, um, sometimes
Yeah, we're gonna go, right?
It's really important as a tool to kind of show the patient what you're planning. Sometimes, what the patient wants might be completely different to what you want or you think is aesthetic. Uh, Simplest example is, some patients want very straight teeth with flat edges and no embrasures. Um, and, that to me is a completely unnatural look. And you would really have to force my hand to give a patient that. So, you know, if a patient wanted that, and after they've seen my wax up, they've seen the mock up on their mouth, and they say, can we get rid of these embrasures? I would have to show them a lot of photos of famous people with nice smiles and explain to them, look, the reason their smile looks nice is because they have these natural uh, spaces, and if we got rid of it, it would just look fake, it would look old. And I would go out of my way to try and convince them to keep them. But if they still insisted, I guess we would have to change the wax up, we would have to change the plan, and give the patient what they want. But it's a good tool to kind of iron out these issues before they happen.
Yeah, yeah, definitely. So, okay, there's something you teach on CERIC. How has that changed your dentistry or preparation? How did you kind of get into that?
um I actually don't remember how I got into it. I guess I was just doing a lot of CEREX, and I was posting stuff online. And I think Murray Orr, he's in Gold Coast. He approached me one time and he said, "Hey, can we do a course together?" And we did a course together. Um, I mean, I just really enjoy sharing my knowledge, sharing what I've learned. I like to simplify things, because I think a lot of the times it's easy to complicate things, and they don't really need to be complicated. So yeah, CEREC was just another thing that we could teach. So
Fair enough. So everyone knows you for your aesthetic dentistry work, which is phenomenal. But what I want to talk a little bit more about is, your interest in endodontics. So talk about that, because you mentioned before, you've struggled with it,
yeah,
and then that was kind of something that you really wanted to hone in on, tackle more of your weaknesses, and then go from
yeah.
there. So, and now eventually it's turned up to be something of an interest for you.
Yeah, I mean, I am interested in it, but I wouldn't say uh, like I know what I can do and what I can't do, and I will sometimes, it's a case where I think I can do it, but it would take me so long. You know, if it's a curved canal on a 70-year-old patient, where I have to, let's say it's upper six, which is going to have an MB2. The time I would spend cleaning it, would just not justify my fees. And I want to be able to do a good job. So I find I would not attempt a case like that, even though it's something I could complete. But a lot of the time, it's the time it takes is not worth the fees you can charge.
Yeah, no, I hear you. So you want to do good work, and you want to make sure the patient's, comfortable as well through it. You don't want them constantly coming back. You don't want them to be spending there long periods of time doing a lot, treatment back and forth. So,
Yeah.
but first, would you say that you learnt through the hard yards through that, or would you say you attended a bit of CPD to kind of build up that understanding to where you're comfortable with endodontics now?
I think with everything in dentistry, you need a bit of both. You need some good CPD to kind of get you on track. And then a lot of it is practice. A lot of it is putting what you learn into practice to develop your confidence. I think that's key. Like, if you have made every mistake you possibly can, and you have fixed all those mistakes, then nothing scares you anymore. It's like, I have broken a file. I know I can get that file out. So to me, it's no longer something I'm scared of.
Talking about broken files, I mean, we actually crossed paths once, actually, at an endo workshop. I don't know if you remember. It was with Yoshi, I think it was a file removal workshop.
Exactly.
Yeah, I was watching you do that, yeah.
Yeah, so, since that course, I have broken a file and I've retrieved that file. So, it's just a matter of, I think dentistry overall is just making all the mistakes possible and being able to fix all those mistakes. And then you either learn, hey, this mistake is something I never want to repeat. So what can I do to never repeat it? Or, you know what, if it happens, I can manage it. If you break a root tip, you break a file, or, just whatever complication you can think of, if you know how to fix it, it's not scary anymore. That's basically dentistry. I think.
So basically you're saying that because a lot of times I like to ask guests, how do they, is there a method to how they choose or structure their CPD? But in your case, you would just say it's more that there are a few of these instances where you broke a file, or you had a tough case. And you weren't quite happy with it, and that's when you decided, okay, I should go and find this particular course now and see if I can learn, and then that way I don't make that same mistake. Is that how you kind of approached CPD?
I have approached it in the sense that I've just focused on one aspect of dentistry. So there was a time where I was just doing composite courses because that was the one thing I wanted to get better at. And then there was a time where I was just doing implant courses. So I seeked all the possible implant courses there were, and I tried to do all of them. That's kind of how I've structured my CPD. I just want to focus on one subject at a time, immerse myself in that, learn as much as I can, and then practice as much as I can. And hopefully by the end of that, I will be better at it.
Yeah, I think that's an interesting point that you've pointed out, because for a lot of graduates that come out, they're so confused, and because they want to learn everything so quickly. I want to learn implants, I want to learn ortho at the same time. And you're like, but what you're saying is slow down. Just focus on one thing at a time. Try to learn as much as you can about it. And then once you've learnt it, and, whether it be in implants, you might decide, okay, I don't actually feel comfortable with it, or I don't actually like it as much as I thought I did. So I pivot and I do something else. Or it's like, I've come to a point where I just want to learn as much as about my composites, about my aesthetics, and then move on to the next part.
Exactly. That's pretty much how I've done it till now. And you said, with implants, you may not like it, and that's exactly what happened with me. I think I spent more than $200,000 on CPD courses only on implants, and I don't even place implants anymore. So, but I have the knowledge. I know how to do it, and I know, I restore them, but I don't place them. So, and I don't think it was a waste. I got something out of it, just the knowledge that it's not something I want to do, you know.
So I'd say, I mean, to that point, like you spent, let's say call it 200,000, but like at the end of the day, it's not so much how much money you put into it. It's more just, you could put a decent amount of money into it still, maybe like 10K or something like that, and then really just kind of immerse yourself in it and not try to be too distracted by other things at the same time.
Exactly.
And then determine it from there, right?
Exactly. I think first the first point I would just say is try not to copy someone else's journey. So if you see your friends are doing, they're doing implants, they're doing ortho, they're doing everything, that's not necessarily what you should be doing. I mean, you can use it as a guide, you can use it as a benchmark if you like, but if you find that you're not enjoying it, you don't have to follow that path. You can change your path, and there's no one path that is better or right, or you could
Yeah.
be an amazing amalgam dentist, carving amazing amalgams, and um, not do any composites. That's one extreme. Or you could just you could be good at everything. I don't
There's
think.
no one right path. Yeah, I agree with you. And that's what we're trying to hope for our community. When we talk to different speakers, where, a lot of people are like, how do I do a path and whatnot? And, if you listen to all of it, that's what our community will probably find, is that everyone's got a different pathway of doing things, and there's no correct path.
Yeah.
A common question I ask guests is, what CPD was a game changer for them? And you've mentioned in the past how Dr. Mario Ferrani, a European prosthodontist, was that? Sorry, I said the name wrong.
That's okay.
Changed the way you understood occlusion, aesthetics, restorations. I mean, what do you think changed in your understanding that so many other presenters who were teaching you before couldn't communicate to you?
I think it was like, when you plan a course. So if today you were planning a course, you would have to kind of keep in mind that you're going to be presenting it to a different level of dentists, right? So some might be really good, and some might be not as good. Okay, so in your course, you have to plan for the whole range of people. I think when I went to do Maro's course, I was no longer here. I had a whole base of knowledge that was already built, and all he had to do was kind of connect the dots for me, and it made sense. I think that was the key thing, that why I say his course was really good, because it just put everything together. If I had zero knowledge about teeth before that, I don't think that one course would help me. So I guess it was just the right time and the right course at the time for me.
I see. Yeah. So, I mean, it's a build up of things, and it's a build up of those knowledge, and then with that practice as well on the side to put it all together.
Yeah.
Because a lot of people talk about, there was this is the one particular course, and you have to attend it because it's going to change your understanding. But what they don't explain is what you've just said, is that it's been a build up of knowledge. They learn something a little bit extra along the way, and then they again tend to this one, and that kind of pieces it all together.
Exactly.
Yeah. So, was there any other particular CPD that was a bit of a game changer for you as well?
I think Jason Smithson course was really a game changer, because that was the push that I kind of needed, the inspiration I needed at that time. And then Maro's course was really good. I mean, it's really well structured, and it's basically just prose because it's fixed prose. Um, so yeah, it was just those were the things that I was looking at the time. So yeah.
Yeah. So I guess was there any CPD that do you feel that you did not implement or wasn't as beneficial for you at the time and you would do differently next time? I know you've briefly just mentioned, that CPD in general, you always get something out of it, but, for something, was there a particular one that you didn't feel wasn't as beneficial for you at the time?
Um, Not really. I would say the the worst return of investment on my CPDs would be my implants courses. I went to Cambodia, did the hands-on course there. I went to Colombia and do the hands-on course there. And they're expensive courses, and I don't really do implants, so I didn't get much of a return on my investment there. But I guess I learned how to raise flaps. I learned how to, suture things, and I learned how to put implants in. But yeah, that was, I
I,
guess, yeah, I didn't get much out of it.
I guess it kind of complemented, what you were doing at the time was probably doing a lot of oral surgery, wasn't it?
Yeah, yeah. I mean, I would say nothing's ever a waste. Even if you learn that this is not meant for you, that is something that you've learned.
Yeah.
Um,
Was there any particular telltale signs that, you realize, actually, I don't actually enjoy this one as much as I thought I did? Because obviously something would have compelled you to get into it, and then obviously something changed to make you think, actually, I'm not that interested in it.
Yeah, I think what compelled me was and it's something that we all have it in us, is like we always want to get better. We're always looking for what is the next step in my career, right? So it might be like, for example, practice ownership, or it might be, I want to learn that next skill. It might be ortho, it might be implants. For me, it was implants. So that kind of propelled me. I'm like, okay, I have a practice. I want to implement a new procedure. Implants it is, so that's what propelled me to do it. It was just that drive that we all have about what the next step in our career should be.
That's right. You actually kind of beat me to the question. So yeah, you were a practice owner once, and you still excel in clinical dentistry today. I mean, and in fact, like you've mentioned, Tony Rotunda is someone you aspire to. Would you ever consider specializing? Because for a lot of our viewers, they reach a point in their career where they want to take it to the next level, just like you've said.
Yeah.
Practice ownership, specializing. Do I become a super GP? What are your thoughts on all of that?
I think it's hard. It's a hard question to answer because you really need to know yourself for you to be able to answer this question. You know, for me, like I tried practice ownership because, as a dentist, I would say 90% of the people would be like, my ultimate goal is to have my own practice. So I tried that and I realized it was not for me. And I think it's something that nobody can tell you, until you do it yourself. You will not realize the challenges that come with it, the type of personality you need to have to be a better owner than, if you don't have certain traits, these kind of things, nobody can tell you. So you must learn by your own mistakes, I think, to some extent. Um, what would I say to somebody who was considering specializing or not? Like for me, the choice is I can specialize, and I guess, you know, 1 month in a year I might want to specialize, because I think, I just want to do pros, for example. But I do enjoy other aspects of dentistry, and I see a lot of, I work with Tony, so I see a lot of the really difficult cases that come through the door, and I am glad that I don't specialize, because I would be getting those kind of cases. And it's not that the case is hard, it is the person that is hard that's attached to those teeth. And as a non-specialist, I can just say, hey, go see Tony or go see this other person. But as a specialist, if somebody has sent them to me, it becomes harder to say, I don't want to treat this person. And it's not because the case is hard, it's just the person is very difficult, or their expectations are just, hard to deal with. Yeah, so I would not specialize personally. I think the commitment required, firstly, is huge. Um, you would have to give 3 or maybe 4 years of full-time study and give up earning for that time. And I just don't see the return of investment being as good as it would need to be. For that.
You mean at this stage in your career? You mean?
Yeah, at this stage in my career, I would learn a lot for sure, but what extra procedures will it enable me to do that I can't already do? I don't see very many. It would just allow me to treat more difficult patients, but do I really want that? I don't think so. I'm quite happy and content not being, seeing those people. My philosophy is I want to keep my practice as stress-free as possible. And I don't think specializing helps in that regard. It would just take me down a path where it's more stressful. So, I don't want to put myself through that.
That's fair enough. So, that's a good kind of segue to what I want to talk to you about next is, have you openly, you openly talk about your struggles before, you talked about your early years of dentistry, where you couldn't sleep at night because you weren't happy with the work you're providing, even though you're doing your best, but you knew you could do better. How about now? Do you, as a more senior clinician, do you feel more pressure to perform given that, you post on some amazing cases, but the people around you might expect you to perform excellently all the time,
Yeah, I think the pressure is only what you put on yourself. So, I kind of understand I'm a human being. I have good days and I have bad days. Last week I obturated a molar and I took a post-op here, and the GP had kind of bent at the tip and it didn't go all the way. So I had to, take the GP out and redo it. So, I make mistakes just like everyone else. It's not, I'm not immune to these things, but I don't necessarily put any pressure on myself. The pressure that I do is I just want to do a good job. And if I'm happy with what I've produced, I'm happy. Can someone else do a better job? Probably. But, I don't put any pressure on myself to, I don't beat myself about it. Because you will never be happy if you do that. If you take a photo of anything you do, you can always nitpick at, oh, this could be better, or this could be better. It's never going to be perfect. So you just have to kind of find a way to be okay.
You know what I find reassuring was when I was looking through your Instagram, there was, one particular case of post that where you mentioned you were stressed out about this wafer thin feldspathic veneer on an upper lateral. Yeah. And, you were just talking about how it's not all roses.
Of course, yeah. That case I remember because I've only ever done one of those cases. It was a no prep kind of feldspathic veneer. Technically it is 100 times more difficult than a normal veneer. But I've done it once and I've learned that I don't want to do it again unless my hand is forced, unless I have a patient who says, I want, specifically this. So you learn something and I learned something.
Yeah. Moving on, I don't want to understate how much Dr. Tony Rotunda has been this phenomenal Australian prosthodontist has been a big influence on you, not only as a clinician, but, as a human. But is there another interesting story, apart from the one that you've just mentioned about, the palatal anatomy, that demonstrates just how much he's had an impact on your life, both as a dentist and as a human being?
I think the biggest influence he has is when I see Tony work, I he strives he strives for a level of excellence that doesn't come naturally to me, right? And when I see him putting in that much effort into small things, so for example, making temporary crowns or temporary veneers, Tony spends such a long time trying to get them looking, you know, perfect, like much better than some permanent crowns I've seen. Tony spends a lot of time doing that. And, um, I just take that as an inspiration. Like, if he is doing it, means I need to be putting in that level of effort into the same things. Otherwise, I will never get to his level. So, he inspires me like that. He just gives me something to work towards. Yeah, I guess that's his biggest gift to me.
One thing a lot of new grads want is mentoring, and people interpret that differently. Some people want to be held by the hand, some people want to just be checked on once in a while, others want to be just a fly on the wall and just learn by observing. When what I'm trying to get at is, I'll put it to you, is because there was something I was hearing about recently. It was just like, and I wanted to share with you, was that, we all want to follow the best and learn from the best. But a lot of times, I imagine in your particular case, people are always messaging you. And, in today's day and age, there's so much content out there, and, people can learn so much from the best by either listening to their podcasts or listening to or reading about some of the stuff they do. I mean, what are your thoughts on all of that? I know that's a lot to chuck out at you.
No, I completely agree with you there. You can learn a lot without actually, on your phone, just watching videos. There's a saying like, which goes, a smart person can learn more from a stupid question than a stupid person can learn from a smart answer. And I think that is true, like, for CPD courses as well. Like, if a person's brain can pick up things without being told, you might watch a video, for example, you might learn a lot just by watching the video and without any explanation of why the dentist was doing what he was doing. I think, people exist like that. They can just learn from photos or videos. But I'm not convinced everyone is like that. I think some people need to be told what to do, why to do it. And I guess it just depends on, what kind of person you are, whether you have that cognition that you can just pick things up very easily, or not. That would determine the answer to that question, I would say.
Yeah, no, that's fair enough. Because I imagine, like, I'll assume a lot of people, messaging you, and, you're a busy person, and it's quite difficult to kind of share your knowledge in over a few text message or just, a message here and there, isn't it? So,
yeah, I mean, I quite enjoy intelligent questions, I would say. If somebody, send me some photos and say, give me your thoughts, I'd be happy to give my thoughts. However, sometimes, what bugs me is, like, they're asking something, they've already treatment planned something, in which I think is the wrong plan, or it's, the solution is much more complex than they make it out. And, you explain it to them, but they don't want to accept it, or they don't want to, change their plan. That kind of, I'm like, well, if you just wanted reassurance from me, but you're not getting it, why did you even bother? Just do what you want, don't ask then. Anyway, yeah, it happens often, I would say.
So what would you say your current ideal clinical day kind of looks like? Types of procedures you might be getting up to.
If I could just do like one procedure, it would just be veneers all day. Can be composite or can be ceramic. It's just, improving somebody's smile quickly is so it's such a gratifying thing to do. The patient leaves happy, and you feel good about what you've done. It's just a great feeling. So that's what I would want to do every day if I could. Yeah.
Yeah, okay. And what do you hope your ideal clinical day or non-clinical day would look like in 5 years' time? And if so, what kind of CPD do you want to do to kind of get to there?
Again, just doing veneers all day would be my ideal clinical day. My non-clinical day, I guess, would be something to do outdoors, like maybe go for a hike, take some photos, that kind of thing. I don't think I need to do very many CPDs on this. I just need to do more. That's it.
Yeah, fair enough. And fair enough. So, you know, as Dr. Sal, I mean, I just want to say, for the first time I met you was back in Adelaide. I don't know if you remember back in 16 and 17.
I remember, yeah.
And when I had the chance to talk to you, I felt like I could feel your kindness and your willingness to kind of share everything. And I love that, and over these years, even when I've messaged you here and there as well, I know you're like super busy, and I just want to say thank you for listening out to this kid.
I mean, thank you for approaching me. I would say it's no matter how busy you are, I think it's important to remember where you come from and stay humble, most of all. It doesn't matter how good you are. I think if you're not humble at heart, I think it's a waste. I think
it's that and gratitude, isn't it? Like just being thankful for kind of the things that we have around us, and not to take it for granted, isn't it?
Exactly. Yeah. Exactly.
Yeah. Do you think there's anything that we didn't discuss today that you wanted to lend to a young budding kind of dentist that's kind of graduating at the moment?
I think the main message I would want to say is don't be in a rush. Don't be in a rush to be amazing from day one, and don't be afraid of making mistakes. Like that's how you learn. That's how you grow. By making mistakes, learning from them, and hopefully avoiding them in the future. And if you do make mistakes, don't be super critical of yourself. Like, don't let it define you. Don't let it destroy you. I think a lot of the times in dentistry, if you were to make a graph of your confidence, it would be kind of a gradual curve, but every now and then it would come crashing down when you have a failure. If you had a failure in extraction, suddenly you would avoid doing extractions for maybe a month because your confidence is destroyed. I would say you must always try to pick yourself up and continue with it. Don't just give up because you had one bad case or two bad cases. It's just everyone has those, okay? Everyone has them, and it doesn't stop. Like, it's not 1 year or 2 year or 5 years or 10 years. It will happen, for a very long time. So don't just think, hey, I'm 5 years out, I should be, good at this, but I had this bad day. Everyone has those. So, that's what I would say. Anyway.
I mean, I think it's interesting. A lot of people say, don't rush. Don't feel like you have to be in a rush. But what you really mean, and I'm just kind of trying to decipher it, is, make these small little increments along the way. Work towards it. So it's more like the bigger picture is like, don't rush. But you're still in a kind of macro sense. You're still kind of you're still kind of chipping away at it. You're still kind of attending courses, you're still kind of working on cases on it like that, and slowly kind of making your way there. That's what you mean, isn't it? That's what people say when they say
of course, keep growing. Like your growth should never stop, and whatever tools you have at your disposal, whether it's CPDs, whether live or online, or just watching YouTube videos maybe, or looking at cases online, whatever it is, I think growth should always continue. Like, you never stop learning. Try to go and observe people, if possible. Other dentists that or your specialist that you refer to. Try and go and observe them, and if nothing else, you might learn one of their jokes that you can use on your patients. Just take whatever you can, learn whatever you can. The learning journey never stops, I think.
Yeah. One thing I'll put to you is we haven't released her episode yet, but Dr. Michelle Chen actually mentioned this in her interview with us, was that she attended one of the Euroaesthetic courses, and then she was like, I'm going to go and practice this out. And then what happened was, she didn't do a great job, and that kind of actually set her back, and she didn't feel very comfortable with it. But the interesting point was she went and attended your course again and actually felt very inspired by it. And then went back, and she felt like after attending it the second time, she got a lot more out of it, and then she could go back and apply it.
Yeah, well, Michelle is someone I work with, so I think I know what she was talking about. It was kind of her first big case, with veneers, that sort of thing. There was quite a few things that needed to be better, and I kind of helped her partly with some of those things. But I have seen her progress, and it's phenomenal. I am glad that she didn't let one thing upset her. That one setback did not destroy her confidence. She was determined to get better, and she's now doing some amazing work. So I'm really glad to see Michelle's journey, and she's not alone. There's a few people like that. And I'm proud, I would say, when I see them doing good work. I feel in some little way I've helped this person.
Yeah.
Yeah.
Whether it be big or small, it's just being able to kind of share your knowledge, isn't it? Because we were talking about knowledge has no value if you can't share it with anyone.
Exactly. Yeah.
So, Dr. Sahil, thank you for coming on the show today. If you could let the people know how they can find you or what's kind of going on in your life.
Well, I have an Instagram page.
Which we tried to get working just then, but
Yeah, I do. I'm mostly on Facebook, though. I have two pages. One is about dentistry. It's called General Dentistry by Sahil. One is about photography. It's my hobby. It's called Faces and Places, photography by Sahil Soni. If anybody is interested, they can check those links out, and just send me a message if you want to get in touch with me.
I've actually used it a few times, and I've messaged you as well. And you've got a YouTube page as well, which I refer to every once in a while.
Yeah, well, I've put some videos on there, and I think if you're one of those people who doesn't need a commentary, if you watch the videos carefully and you ask yourself, why is he doing this? You might learn something.
So, for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe. For our listeners, if you like this episode, leave a review as well, but don't forget to share it with your friends, and we'll see you in the next episode of CPD Junkie Podcast.
Thanks, Lawrence.
Thank you.